reports going on, but actually news and developments and stuff, not so much. So, Kayla is recording this, and then once we're done, we have it very quickly. Sometimes before the end of the day, it's already on our website. In case you get called away for an emergency and or you want to share something with some of your coworkers that you think it might be helpful or important for them to have the information that we are bringing you today. So as you can see, Kayla is our MOTS system administrator, and she's also the Rhodes product owner. And Rhodes, of course, I guess everybody by now has heard of that. It will be replacing the MOTS system. When it's exactly going to happen, we're still a bit out on that. So we had a date at the end of this year, but I think it's been postponed a little bit. So again, my name is Piet Vermeer, MOTS Senior Systems Analyst, and not only MOTS, but all kinds of other systems and data warehouse and the roads and basically a systems analyst and very senior. So Mary is our MOTS support specialist, and Jody is our EDI specialist. She knows everything, and today is an EDI session, so the focus will be a little more on EDI. And if you have any questions about any of the files, dropping the files, and any issues with access through the FTP, then Jody is the person to find. Justin is our report specialist, and Anna is also here. And then I forgot to mention Cecilia. She is also our support specialist. I don't think she's here today, but you might run into her if you have any questions or if you send in any requests. So, okay, thank you. Next slide. The purpose. Why do we do this? Well, of course, to give you any information on any changes and any enhancements, updates, upgrades. It is a system that is alive, and it is in a state and federal world that we have to have all kinds of rules, regulations. So the system once in a while is tweaked or improved or enhanced, or based on your information, we sometimes say, well, maybe this is not really working for our treatment provider, so maybe we should see if we can do something about that. And that's, of course, going to getting your feedback. That's why we love these webinars, that we give you a platform at least once a month, and we're always there, of course, for answering questions on our websites or on our email. But data issues are close to my heart, definitely, being a bit of a data geek, and we love to discuss them once in a while. Sometimes things seem to go in a certain direction that we are not really sure if everybody is on the same page, gathering certain bits and pieces of information. So we like to use this platform to explain certain pieces of information that we're looking for sometimes, or sometimes if there's new pieces of information or older information that seems to be getting away, or we're losing that. So as I said, the feedback, any future ideas for future topics, anything that you think you guys run into all the time during while you're working with the system or with data in general, let us know, and maybe we can make it an item on our agenda. And again, when you have any questions, the nice thing about this Teams tool is that it's a lot easier to be interactive and a lot less hassle to get you guys in and get and answer all kinds of any kinds of questions that you might have. Okay, next slide, which is the news update. Well, as I mentioned at the beginning, there's not that much news. The data warehouse, the BHDW, Behavioral Health Data Warehouse, is live. It's up and running, and we're working with our research, with our health analytics research unit on tweaking it in such a way that we get the best out of the data warehouse. It's not available to the public, and I'm guessing it will not be in its current state. We might get a front where you can access information that you might be looking for, and we might help you with that. But that is still in the future, the way I envision that, and that's kind of my vision, and I'm not sure if that's everybody else's vision as well. So we'll keep you up to date if things like that start happening. The road system, the resilience outcomes analysis and data submission, is nearing the end of development cycle 2 So we're doing a lot of UAT. There's a lot of chatting going on back and forth between all the testers, and everybody's running into things and expecting certain things and not seeing things here and not seeing things there. So there's a lot of buzz going on. It's kind of a fun time when people are comparing notes and doing all kinds of testing. So, and it's usually a big jump for the system to kind of gather all the information, and a big learning curve during these testing times. So. MOTS, the admin pause, is still extended, and I think there's a little
Hey,
more
Pete.
detail
Oh,
about that a little
yep.
bit later, is one of the
Yep.
slides that I noticed. And the MOTS support, the new email address, if you haven't picked it up yet, is now MOTS support with odsoha.oregon.gov. And the same goes for roads, odhsoha.oregon.gov. And that was my news update. Thank you, Kayla, and I'll give the microphone back to you.
All right. In that news update, I just realized I did not update the MOTS portion about the administrative pause, but Jody is going to mention that in a minute or two. And now I'll hand the microphone to Mary to discuss our new value.
Okay. So good morning, everybody. Good morning, Kayla. Yes, we have added a new drug to the substance abuse code table, and that is fentanyl. And so we encourage you to update your systems to capture the new value. And the information is on the screen. And back to you, Kayla.
Thank you, Mary. And information about our administrative pause update. Oh, we have a question. Sierra or Susie?
Hi.
Hi.
I just want to make sure I added the fentanyl to my system in CareLogic, and I want to make sure that the max value is 20. Is that correct?
Yes.
Yes.
That is correct.
Susie, that is correct. We I think we were the last valid value we had was 19 in the substances. So we just added it to the next one in sequence. So 20 will be what's accepted.
Thank you.
Yep, you're welcome.
All right, Jody, you want to take it away?
Yeah, sure. I will go from there. So yeah, so the administrative pause, it's been definitely a topic that has been around us for about 3 years. I think we all started with the pause when it was introduced back in mid 2020 during the pandemic. So during that time, our reporting requirements were scaled back. But now that the public health emergency has officially ended, regular reporting requirements, which we all kind of figured was going to happen at some point, are going to go back into effect. So as of October 1st, the administrative pause on the MOTS reporting will end. And this will require that providers are to resume reporting the updates that used to be 90-day updates. I think y'all remember. That piece is one of the big ones that was paused. So you've been putting in your admissions and you've been putting in your discharges on clients today, even with the pause going on. But those 90-day updates were what were kind of put on hold. And some crisis reporting was put on hold, but many of you didn't pause because it was already built into your workflows and your systems. So you've continued to do that. So we just wanted to mention the 90-day at a minimum updates will resume October 1st. And what that means for some of you that maybe are new to this in the last 3 years. So sometimes we know that clients are in treatment for a longer period of time. So you let us know that you've brought them in with an admission date, right? And that they're active. And then maybe it's 6 months, 12 months. It might even be a couple of years that folks stay in treatment with you, especially for behavioral health services. So instead of going 2 years for OHA to get an update on those clients. What we had and will be doing is every 90 days you update us on the status of the client. So ideally you send in that information with updated values. So if things have improved or things have changed, you would change, update that in your, so if they were married and then maybe they're divorced, that would be an update. If maybe they have more dependents or less dependents, income has changed, source of payment, those kind of things. Of course, the admission date will stay the same. And of course, you'll still be telling us that they're active. So that's why the 90-day updates are important at a minimum. Some organizations send them weekly or they send them as changes happen. And that is perfectly great because we love to get all that information so that we can really see and assess what's working and what's, maybe needing a little help for clients' treatment. I also have for that pause the MOTS reporting. That's the piece that's going to resume. Mobile crisis and stabilization reporting started on May 2023. So if any of you need information on that, reach out to us and we can get you connected with the most recent information going out. And service element reporting, that's another big one for a lot of you, will resume as well on October 1st of 2023. So if you need to, this pertains mainly to the CMHPs or the counties that are in that role. But if you do have any questions on that, let us know and we can try to help get you connected with someone that can give you more information on that. It does say that refer to your financial assistant agreement and begin reporting for your quarterly service element reports. October through December, say of 2023, is going to be due on February 14th of 2024. Seems weird reading that 2024. Come a long ways. So yeah, we do have a memo that came to us, and so we can also get that redistributed out to everybody regarding this subject. And again, if you're unsure, of what to do or don't remember, you can always reach out to us and we'll help you and get you pointed in the right direction. So with that, are there any questions I need to take or are we good to progress? I can't see the chat.
I don't see any questions in the chat, Jody, and I don't see any hands raised. So I think we're good to move on.
Okay, perfect. Thank you, Kayla.
Thanks, Jody. And I'm going to pass the microphone to myself and just do a quick plug for our MOTS refresher. So this is kind of a dual purpose webinar that we started a couple months ago to give providers who might be new or to give folks in organizations that might be new to the MOTS responsibility a chance to ask questions, see the system, and kind of get the background of the who, what, where, when, and why of MOTS. And that webinar takes place on the second Wednesday of every month. So that'll be next week, July 12th at 10 a.m. And it just gives folks the opportunity to learn why we're collecting this data, how the data is used, and then to essentially have another platform to ask us questions or get some clarification on anything that might be confusing, because we want to make this process very simple for folks. And we know that by providing more opportunities to interface with us and get to know us and get to know the system, hopefully folks will get more comfortable about submitting data. So I will pass the microphone back to
How do
our
I sign up for
EDI.
those refreshers?
That's a great question, Pete. I will throw that link in the chat. And it's also in our MOTS messengers that go out every month. I think it went out last week. There's always going to be a link to our webinar and always going to be a link to sign up for the refresher course in that newsletter. But I will throw it in the chat right now so that folks can access it easy. Thanks, Pete, for that reminder.
You're welcome. Thank you.
All right,
Okay.
Jody, it's all you.
Okay, sounds good. All right. So switching, this says switching from CE to EDI, but really this is about if you're changing systems, right? So if you are currently client entry and you're looking to go to EDI, then this will be relevant to you. And hang on one second. Okay. And also this is would be applicable to you all if maybe you're looking for a different EHR system, or maybe you're upgrading to the newest platform or one that your current EHR system has. So if things are changing, first thing is let us know. We're all super busy. You all are, we know. So we want to know as soon as possible, even if it's a month, 2 months, a year, maybe a couple of years, we can help kind of stage things and make sure we get you on our map. If you are looking at different health record systems, please make sure that you just really ask about the MOTS functionality. We always know it's high on your list when you're looking at systems. And some of the things that we found is just finding out what's the actual business process for the MOTS functionality. You know, how's it going to work from the time your client comes in the door till the time that they exit your facility and all of their submissions to MOTS, how much staff time will be required and who's going to do what. We always put the caveat there's no one way that is better than another. There are just differences in workflows. So sometimes there's always a myth that, which I think you all know is not true, that when you go to EDI, there's just no human interaction needing to deal with MOTS. And there always is some element of it. So knowing what that is and how it works and who's going to do it is always super helpful when you're kicking off a new project or a new upgrade. Project timing ties in with letting us know of the change or the possible change. That way we can get everything aligned with our calendars and whatnot. There's a process for switching data submission methods if you're currently client entry. So we go over that. The secure file transfer protocol setup, that is really like the mailbox, the server location, where either your system or somebody at your organization is going to put your files in so MOTS can pick them up and process them and send you back your results file. If you are currently EDI and you're going to a different EHR, there will be a you're going to use the same SFTP directory, so you won't have to get that set up new. We do like to look at client IDs to see if there's any considerations, if those are going to be changing or need to be updated. We can help give you some ideas on defining business processes surrounding the MOTS aspect, of course. We do testing of your files. Sometimes you may pick an EHR that is already successfully submitting to MOTS with various, other providers, but we do certify and test at your level because with all the customization and different ways of setting up systems to meet your needs, we want to make sure that all the mapping, as Susie asked about, that all of that is lined up and in the background working well. So we're going to test your stuff. You're going to go live once all that's done, and then we'll do some follow-ups. Even if you are EDI and you're just going from one system to another or an upgrade, you still can get follow-up sessions if you need them. We're happy to help you through your journey and getting your data into us. So with that, Kayla, I think that pretty much covers this element of our webinar. So I'll turn it back to you.
Awesome. Thanks, Jody. And I think that brings us to the end here. We had a short webinar for folks. I did not update. I always forget to update this slide for our next webinar. But our next webinar is going to be August 2. So that will change on this slide. Otherwise, keep a lookout for updates on our MOTS Messenger, because all of this information is also I make sure it's in the messenger so that folks can read it, and people learn differently, people absorb information differently. I want to make sure it's absorbable for everyone. If you want to chat with us, our contact information is listed on this slide, along with our website and our group team email at MOTS support. Does anybody, any of the MOTS team have any closing remarks before we let folks go? Okay, hearing none, I will say thank you for joining our webinar, and we will see you again soon. Bye-bye.
Thanks, Kayla. Bye, everyone.
Bye.